Good morning. I'd like to welcome you to our update on the status of the MOU for the Regional Medical Center in Prince George's County and the unveiling of our Transforming Health in Prince George's County Public Health Impact Study. Prince George's County is a county of contrasts. It's known for the affluence of its African American community, and while crime rates are falling and test scores are rising, it is known for its challenges in the areas of public safety and in education. It is known for its suburban homes outside of the Beltway, but also for a densely populated, underserved community inside of the Beltway. A county that is home to a great university and community college system that is primed for transit-oriented development, but one where high-end restaurants and retail stores have been slower to come than what our demographics and our nearly $25 billion in salary income can support. A county with great potential, but one that needed a string of wins that would propel us towards a vision set forth by our county executive to be one of the best places to live, invest, work, and visit. Our winning streak started in an area that we're not well known for, and that's healthcare. With a county executive who made quality health care a top priority and a county council that revived a dormant board of health, our county got a big win early. But we needed more. We needed a world-class academic medical system to see the potential for a regional medical center. We needed state government partners that insisted that this regional medical center be part of a healthcare delivery system. We needed the expertise of a school of public health to best organize a system to meet the needs of the county residents. And we needed the talented and dedicated county medical system leadership to be a partner. This all resulted in the signing of an MOU to transform the health status of Prince George's County. Today, you will hear about the milestones achieved so far. The work that has been done to date is not just focused on our health challenges, but it's also on how to solve them while stimulating the economy and improving the overall quality of life in Prince George's County. So at this time, as we get started, I would like to introduce the elected officials that are here, and let's hope that I cover them all. Yeah, I got you right here, okay. Okie dokie. First, I would like to recognize Terrence Taylor, who is representing Congressman Steny Hoyer. I would also like to recognize the state senators that are here, Senator Joanne Benson and Senator Ulysses Curry. And we have a host, or almost a host, of delegates here. The chair of our delegation, Melanie Griffith, who I will say, Delegate Griffith sat me down early to let me know what a passion she had for health care and has been a great supporter in this process. I'd also like to recognize Delegate Veronica Turner and Delegate Barbara Frush and Delegate Tawana Gaines, Delegate Michael Summers, and Delegate Aisha Braveboy. I'm sorry, and Delegate Jolene Ivey. I would also like to recognize two of our county council members that I've seen here so far. The chair of our delegation from District 5, Andrea Harrison, and Delegate Obie Patterson from District 8. Did I miss any? I would also like to recognize former Delegate Joan Pitkin, who is here. Also, former County Councilman Tom Hendershot. And although not elected, I would like to recognize the president of our community college, Dr. Charlene Dukes, who has recently been elected president of the Maryland State Board of Education. Okay, so I passed that one. So at this time, we'd like to get started with the program, and I would like to first, speaking of dedicated state partners, I would first like to introduce our Lieutenant Governor, Anthony Brown.
Thank you very much, Brad. First, I want to commend you for the outstanding work that you're doing, the leadership that you bring to the county. I had the privilege just recently to be, when we were out at the International Conference of Shopping Centers, to be able to spend some time in meetings with Brad and his team, the team that County Executive Baker has assembled. And I just want to tell you how impressed I was at the presentation, the representation, and the way that you portrayed opportunities and were very candid with the challenges in Prince George's County, but certainly instilled a lot of confidence in the development in the retail community about the great things that are happening here in Prince George's County. So I thank you, Brad, for your leadership. County Executive Baker, thank you for your continued leadership, whether it's your targeted neighborhood initiative, your willingness to jump in with both feet to improve our schools, your economic development fund of $50 million, everything that you're doing, and having spent 8 years with you in the General Assembly, watching you sometimes agonize over the slow but forward progress of Prince George's County, and now you've shouldered that responsibility as county executive. We're all behind you 100%. So keep up the good work, and we really appreciate who you are and what you do. You've got a great council behind you, Council Chair Harrison and her colleagues working together, and that says a lot. Let me tell you, just from someone who's down in Annapolis, and I know that Senator Benson and Melanie Griffith, our delegation chair, and others who represent us in Annapolis can tell you, when we at the state look at counties that have their act together, where counties are working with county councils, where county councils are working together, that's the most effective county that you see, and they get that support from the state. And it's not a reward punishment thing. It's like you're looking for partners that you can work with, and when partners have their own house in order, then it's a whole lot easier to do that. So thank you very much, Council Chair, for your leadership of the chair. I want to thank Dimensions Healthcare. I'm not going to go through the names. Certainly want to thank our partners at the University of Maryland Medical System, as well as the University of Maryland School of Public Health. You're going to hear from Dr. Kleinman soon. And I want to thank all of you for everything that you and Dr. Sharfstein is doing a phenomenal effort. And what I'm really excited about with Dr. Sharfstein is right when he came on board, and like within days, and he was faced with having to work on the implementation of the Affordable Care Act, right, and all these other challenging issues. Well, we presented to him the hospital, Prince George Hospital, and the state's involvement, and we said, look, you're going to have to take the leadership on that. And he quickly realized that it's more than a building. It's not just a building. It's a health delivery system that has to achieve certain goals and purposes, improving the quality of health while expanding access and enabling us over the long term to bend the cost of delivering care. And Dr. Sharfstein, I want to thank you for really bringing that very important perspective to the work that we're doing here. So thank you very much. Today is a very exciting day. One step forward in delivering the world-class health facility to Prince George's County and the region. And today we're announcing the results of the Prince George's County Public Health Impact Study. And the study has found a number of things, and you're going to hear more about it from others, so I'm not going to take you through the litany. But the study is, there are some things that we learned. And it was important that we do the study because you need to understand what the needs are that you're going to address before you can begin scoping out the solution. So this is a very important moment in this process in delivering a world-class health facility in Prince George County. It found a few things. and you'll hear more about it. Number of emergency department visits and the disparities between black and white around certain chronic illnesses. Also that primary care providers, while a shortage in Maryland, while a shortage in this nation, there's a real shortage here in Prince George's County. But the other thing it found is that almost 31% of residents reported using a hospital outside of the county. And they did so because their physician referred them to that hospital. And 13% reported using the hospital outside of the county because their insurance coverage dictated that. But these are not just numbers. These are not just numbers. 18 years ago, my daughter was born. And her mother's doctor, reputable doctor, great physician, had privileges here at Prince George's Hospital and a number of other hospitals in the region. And we had just moved to Prince George's County 2.5 years ago for everything that Brad was talking about, quality of life. We were excited about the changing demographics in Prince George's County, a majority minority county that along all the socioeconomic indicators and benchmarks of success is doing very well. Educational attainment, income attainment, the progress that we're making in bringing quality residential development, and soon as we turn our attention to bringing quality business development. And we were excited about moving to Prince George's County, and we're still excited about being here. Many of you know my daughter, Rebecca, because I share stories about her all the time because I'm proud of Rebecca. I'm proud of the fact that she just graduated Bowie High School this year, is going to College Park as a Banner Kirkey Scholar. I'm proud of the fact, Mr. County Executive, that she really helped boost the AP participation and performance rate. She would kill me if I told you this, but she took 7 of those AP exams. She got 4 5s and 3 4s. I told her that when I was in high school, I didn't even know what a 5 looked like on those exams. So I can tell you as I stand here today as a proud parent that I raised my daughter in Prince George's County, but I can't stand here and tell you that she was born in Prince George's County. Because her physician said at the time, if you want me to deliver your daughter, you're going to have to do it at the other hospital. I said, no, you got to be kidding me. Well, if we can't do it at Prince George's, then we want to do it at Laurel. I said, no. I said, well, what do you mean? I mean, they've got the facilities, they're delivering babies every day, they're saving lives, they got I think a level 2, level 3 NICU unit. I'm like, well, what do you mean? I said, I will not deliver. There is absolutely no reason why any family in Prince George's County should have to experience that lack of choice because either their physician or their insurance company says, you need to deliver somewhere else. You need to receive services somewhere else. This study is eye-opening. And this study is so important because it's going to help us address the real needs here in Prince George's County as we deliver a quality health system. We cannot do it without the unprecedented partnership that you have and that you see in this room. The array of institutions and individuals that are going to make this happen. I'm very grateful for the University of Maryland Medical System. These guys know how to develop hospital systems. They know how to acquire them too. And they understand the services that are delivered, and as importantly, they understand the business and the financing necessary to make them sustainable. So I'm glad that you all are partners, and I'm glad at the step that you've taken to make this happen. Dimensions Healthcare System. I'm proud of what you all have done for years, Judge Nichols, what you have done to deliver quality of care. I'm proud of the men and women, those that are organized with SEIU, those aren't, all of the health providers, physicians, and other allied health professionals, day in and day out, delivering quality care in this facility every day, saving lives and making a difference. I'm proud of you. I'm proud of what we're doing at the state. I'm proud of the University of Maryland School of Public Health. Today, we're taking a step closer to making this a reality. And I was asked this morning by a reporter, what about financing? We're going to get to that. Is the state committed? Are the partners committed? And the answer is, you bet we are. You bet we are. We are committed to making this a reality. Thank you very much.
Okay, thank you, Lieutenant Governor. I would like to, at this time, recognize a few more elected officials and other people who have come in. We have here our Councilman Will Campos from Prince George's County Council. And we also have Councilman Eric Olson has come in as well. We also have Councilman Derek Davis who's come in. I would also like to recognize Nichols Schultz, who is here from Senator Mikulski's office, and Altman Purnell, who I believe is representing Councilwoman Turner, who could not be here. So as we move through the program now, I would like to introduce our council chair, Andrea Harrison.
Well, good morning, everyone. It truly, truly is an exciting day here in Prince George's County. We've got some wonderful things going on. I do want to just say to you, welcome to District 5. You are sitting in District 5, and I do represent this area here. And I'm so proud. I'm so proud of Prince George's Hospital, this particular facility, and then the system as a whole. While I don't have all of the stories, and I'm not going to take up as much time telling stories as the Lieutenant Governor, but I will tell you. Yeah, I will tell you, though, that the employees, the staff here at Prince George's Hospital Center and within the Dimension system are world-class, #1, and I trust them with my very life. And I will tell you that I spent almost 6 months upstairs going back and forth between ICU and CCU with my mother last year. And I can't tell you the service and the care that they gave to my family while we were here was absolutely phenomenal. And even when we had to go to another facility, I just can't tell you. And I will tell you that I've birthed at least one baby within the system. So I believe wholeheartedly in Prince George's, in the Dimension system, and Prince George's Hospital Center. So I just really want to just talk about how excited we are. We were excited last year when we talked about the possible partnership with the University of Maryland Medical System. And we had a number of steps that we had to go through to get here, but I'll tell you that we're very excited about what we're going to be sharing today. I do appreciate the kind invitation from Mr. Seamon, and then it was an honor to follow behind our Lieutenant Governor. You know, the healthcare is an issue that impacts every Prince Georgian, and improving access to quality, affordable health care for all of our residents is a priority for the Prince George's County Council and our county executive. So I want to commend all of the stakeholders who are represented here today, especially the University of Maryland and the University of Maryland Medical System for their willingness to work collaboratively with the state and local government and dimensions to enhance our healthcare system. Last year, the county, the state, and Dimensions Healthcare announced a landmark partnership agreement with the University of Maryland Medical System and the University System of Maryland to build a world-class regional healthcare facility here in Prince George's County. This memorandum of understanding detailed an 18-month multi-step process to develop a strategy, financing, and execution of a plan for the University of Maryland Medical System to build a multi-million-dollar regional teaching medical center and improve the county's overall health care infrastructure. We are at the very beginning of a long journey, but we're moving forward, and our progress is proof positive that we are headed in the right direction. And where we are headed is really, really exciting. So I look forward to working with all of you and continuing the great work that actually began last year, building on a strong foundation that has already been set. So with that, I am going to sit down and I'm going to adhere to the request to stay under 2 minutes. And I'm going to challenge, I'm going to put a challenge out, Mr. Seamon, to the rest of our speakers to see if they can top me.
So you yield the remainder of your time to me. I would like to mention two things here. First, when our MOU was signed, our council chair was actually Ingrid Turner at the time. And Councilwoman Turner can't be here today, but wanted to recognize her. But our current council chair has certainly continued the spirit of collaboration that helped lead to the signing of the MOU. Also, since we are here on the campus of Dimensions, I would be remiss if I did not recognize the new chairman and CEO of Dimensions Healthcare System, Mr. Neil Moore, who is here somewhere. And we also have a surgeon who's on staff here at the hospital, who's also president of the State Medical Society, Dr. Harry Arwat. So at this time, I would like to introduce my boss, the County Executive, Rushern L. Baker III.
Who has just been admonished by the chair to be very brief. Since I have budgets that go before the county council, I'm going to try my best. So that means these great remarks that Barry prepared will not be used. Let me say this before I start. First of all, I want to recognize my mayor, Mayor Callahan, if he's still here from Cheverly. I don't know if he's gone yet, but if we can give him a round of applause. I think he's out there on the phone, so let him know I said that. I also want to, again, give kudos to Councilmember Eric Olson, who was out there on our run this morning. Let's give him another round. And I see that we've been joined by his colleague and our colleague, Karen Toles from the 6th District. I'm 7th. I did that before, didn't I? A couple of things. I want to thank the Lieutenant Governor, first of all, for being here and for being a partner and for really taking health care under your wings since becoming Lieutenant Governor and not forgetting about Prince George's County, keeping us on the front burner. Can we give him another round of applause, please? I certainly want to thank the senators for being here and for once again taking on all the issues that affect Prince George's County and doing a great job. So if we can give them another round of applause. And Madam Chair, I say the best for last, and I'm sure the Lieutenant Governor agrees with me. There is no better, finer place to serve than the House of Delegates, and I want to thank you all for your hard work in getting us to this point. So we can give the House a round of applause, a big round of applause. You know, a couple of things. Let me just say this. We have been blessed and fortunate in this county that, at least for me personally and for this county overall, that we have had the pleasure of having two great chairs. I cannot say enough about Council Chair Ingrid Turner and her commitment to health care. She made it a priority of the council. We certainly made it a priority of this administration, and we worked together to get us where we are. But we would not be here today had it not been for her efforts and the efforts of the council. So in absentia, can we give her another round of applause, please? And certainly someone who I think is the best chair that I have worked with, and I think the best chair. Having been a chair of a delegation and having had the opportunity of trying to lead individuals, it's a hard job. It is not, I'm sure Melanie will tell you, it is not an easy job. I'm sure Barbara will tell you it's not an easy job. But there's no finer person who's doing the job there in making this county move. And what do you say? It's a great county getting greater. Our chair, Andre Harrison, can we give her? So we're here a year later to, first of all, thank all of our partners, the state, the county, Dimensions. For not only being here, but for surviving. For in the lean times, not forgetting what your mission is, not forgetting your true calling, which is not to deal with politics, but to deal with people. Not a single nurse, not a single orderly, not a single person that works in this hospital cares about politics. What they care about is making this community better. That is why we're here. That is the reason. As I was sitting there, I jotted down a little note. As everyone knows, the greatest influence in my life is my wife and my dad and my mommy. But in this case, it was my wife. After I left the legislature, where I truly loved being and had a great deal of fun and had some really wonderful colleagues that I missed, I was sitting at home and I was heard a report about the hospital and whether, in fact, we were going to be able to find funding for the hospital. And I was listening to the radio and, on my couch, because I couldn't go get a job because I missed being in the legislature so much because it was my favorite job. And I was heartbroken, and my wife was sympathetic and was letting me sleep at home. And I was yelling at the radio because I said, we need to find a solution, a permanent, long-term solution to the hospital. And I've got great ideas, and I've got a way we can do it. And then I realized I wasn't in the legislature, and I wasn't county executive. And my wife, who's very smart, said to me, if you have great ideas and you've got a solution, you should share them. And so I did. They were not taken. So I ran for county executive so that I could stand here today, so that I could have the opportunity to ask Brad Seamon when we took over, when we won the primary, to make health a priority, to find me a solution, a permanent solution for this hospital, so that I could ask each and every one of you to work with us to put healthcare on the front burner. Not because it wasn't important to other administrations, but because it is one of the most important things. As we talk about transforming neighborhoods, it's not just about public safety. It's not just about education. It is about healthcare. And each one of those facets that we deal with, whether it's public safety or healthcare, public safety or education, healthcare transcends through that. Many of the problems we have in our schools today is because of access to quality healthcare. Many of the issues we have in public safety is because of healthcare. Today, we step forward and begin to build a regional healthcare facility. Today, we begin that long process of making sure that Prince George's County in Maryland leads the nation in access and dealing with the chronic cares of healthcare throughout this region and hopefully throughout the nation. I'm very proud today to be a Prince Georgian. Thank you.
Thank you, Mr. Baker. At this time, I would like to call Dr. Joshua Sharfstein, who will come to us and talk to us about transforming delivery of health care.
Thank you very much. Thanks for including me in this exciting event. I'm Josh Sharfstein, the Secretary of the State Health Department. I certainly want to thank you, Brad, and the County Executive for the incredible leadership that you have shown in this process. It is an incredible privilege for me thinking about it from a health perspective, to really be able to follow the leadership of the county and the lieutenant governor in really pulling this all together. And I would say, particularly for the lieutenant governor, there are a lot of different moving parts to this, and you see that with all the different people who are coming up here. And it's not natural that they're all pointing in the same direction. But when you have the kind of leadership that we have in Maryland, and particularly with the lieutenant governor's personal involvement in this, it really makes the kind of progress that we're seeing possible. So from my perspective, I wanted to give a special thanks. I also want to do one other quick introduction, which is of the health officer, the new health officer here in Prince George's County, Pam Kriegmer. You're going to get up. That's partly to acknowledge her role to this point, but also moving forward, because Prince George's County is doing a terrific job thinking about the public health system and how it interfaces with the healthcare system. And what this is today is really about is talking about a vision for not just a building, but for a healthcare system that really produces better health and supports the dreams and the opportunities for people in Prince George's County and across the state. And it does that by thinking of it not just as if it's a great ER. It'll have a great ER, but the point is not just to wait for people to have heart attacks and strokes and or gunshot wounds or other things. It's to develop a healthcare system that prevents people from having problems like that, and then provides superb tertiary care also in a partnership with the University of Maryland. So there are a lot of discussions about hospital buildings out there in the country. This is the only discussion that I know about that is framed with a public health perspective. And what the University of Maryland School of Public Health has done is extraordinary. And I see Dr. Thomas here, and I know that there are other faculty who worked on this, but we all came together and asked the School of Public Health to say not just what's wrong in Prince George's County. There have been reports about that. There are some significant health challenges here, but what can be put in place to address it? How do you translate between the problems that we have and the solutions? And the report that they've done is really extraordinary. It identifies some of those problems, it puts them on a map, and it talks about where a primary care network needs to be built in order to link up with the new regional medical center to make a tremendous, meaningful difference in the lives of people in Maryland. And I think it is really a unique kind of report and collaboration, and it's an awesome opportunity to build from the ground up a terrific healthcare system in the county. So, this is just one step of many, but from my perspective and my background in public health, it's a critical step, and I really look forward to continuing to work with all of you as it moves forward. Thank you very much.
Thank you, Dr. Sharfstein. I would also like to recognize Councilman Mel Franklin, who is walking in the door right now. Also, since we're running on time here, one thing I would like to say, I'd be remiss if I did not recognize two people who have, one of which has been in this fight with the hospital for a long time, our Deputy Chief Administrative Officer for Finance and Budget, Tom Himmler, continues to be an important part of the process, and also Betty Hager-Francis, who is our Deputy Chief Administrative Officer for Health and Education. And two of her department heads, Teresa Grant and Gloria Brown, are here as well, and they kind of form our health cluster. So at this time, I would like to bring forward Dashanka Kleineman, who's the Assistant Dean of the School of Public Health and led the creation of this great public health impact study.
Well, thank you very much. It's such an honor to be here, and I just wanted to say to all of the leadership that our School of Public Health has never had such fun. We really developed a team not only within our own school, across the walls of the departments, which does happen in schools as well, but we developed a team with the advisory committee that had representatives from the state, the county, the health systems, and we became one with the vision that has been put forth, putting our thinking hats on to make a difference. So medical care and public health are unusual bedfellows. They each have critical roles in providing for the health and well-being of the communities across the nation. They share a common goal, yet they approach it in different ways, and they've operated independent of one another. Now we have new opportunities that have emerged from the state of Maryland and Prince George's County in particular that bring these two sectors together and allow for a blending that has not been seen in this area before. And this blending and this building will create benefits for the residents of this county, for communities that surround it, and make a big difference for the state as a whole. So it's with that hope that I present our report, Transforming Health in Prince George's County, a Public Health Impact Study. A much longer report is available on our website, and today we have just the summary of the report. We want to thank again the incredible public-private partnership that sponsored the study, and I want to thank them formally, so thank you all. Could the advisory committee members please stand that have played a role? Advisory team members. We convened an interdisciplinary team of faculty, and some of them are here today. Will our faculty team members please stand as well? Thank you. We structured a multifaceted study to fill major knowledge gaps for planning a new system. And for the first time, we now have a scientifically sound assessment of what residents and key stakeholders believe is best for improving health in a new delivery system, and what it would take for residents to spend their health care dollars here instead of out of the state. The study also significantly expands the 2009 RAND report and reviews the supply and distribution of a full range of primary care providers, including social workers and nurse practitioners. It looks at county health resources and how residents with chronic health conditions use hospitals. Additionally, we gathered new data from interviews of leaders of comparable model systems who are moving away from a sickness care model into a model of health promotion and disease prevention, and that is what our study recommends for this system. So findings from multiple assessments allowed us to develop an integrated profile of the county needs, and we match these with healthcare elements that will make significant improvements in the population's health. The most important system elements, according to our research findings, include a university-affiliated regional medical center with a teaching hospital and ambulatory care facilities involved in interprofessional education and team-based care to serve as an anchor to a revitalized quality healthcare system. A strong primary care network housed in accessible facilities across targeted areas in the county that incentivizes providers and is positioned to adopt interventions such as the patient-centered medical home and new workforce models. And the integration of public health and primary care, so critical to achieving health literacy and health equity. With these system elements, we forecast achievable health outcome targets for the county in 2020 and years thereafter that would reduce costly emergency department visits, a 16% reduction for select chronic conditions, and would save lives. We estimate 340 lives saved due to prevention of heart disease and cancer in 2020 and for each year thereafter. So let me provide you with just a few of the findings. Yes, the county's disease burden remains high when compared to surrounding counties in the state, especially for chronic diseases such as asthma, diabetes, hypertension, heart disease, and cancer. The racial and ethnic differences reveal incredible disparities. These diseases and the predisposing conditions such as obesity, prediabetes, and prehypertension require continual and coordinated care management and a major emphasis on prevention. We reviewed 9 clinical primary care workforce disciplines in 3 categories of medical, dental, and mental health. And we found that for each of these disciplines, we have substantially lower numbers than the surrounding counties and the state overall. And when we use federal criteria to determine sufficiency of these providers for a population, we found that the county needs 61 primary care physicians, a 13% increase, and 31 additional dentists, a 7% increase to meet minimum need. We mapped the county's need for primary care services, and the 2 maps are on my left. The first map shows, the one with the red, green, and yellow, shows the results for just primary care physicians. Red indicates an insufficient number of providers. About a third of the county residents live in areas where there's a high need for primary care providers, and green indicates a sufficient number of these providers. A second map, the one furthest from me, adds in population characteristics and hospital use patterns to that of provider capacity, and it narrows the geographic focus of highest primary care need to areas that are located within the Beltway and in the southern portion of the county. We listened to residents and to stakeholders, and they raised a lot of key issues. I'm only going to highlight a few. These are issues that influence choice and practices for health care. Some of these include the importance to residents of having an affiliation with an academic health center, understanding, as we've already heard, the role of insurance and provider referral patterns. That's a very strong enabler for people to leave the county and to come back. And finally, including health promotion and wellness in the design of a new system. And to my right, the figure that we have here shows what the residents of this county have told us as essential services that are vital to a new system. Services such as nutrition education, physical activity programs, family planning, substance abuse services, mental health treatment, as well as urgent need, which we have assessed as having care available when you need it and where you need it. We recommend establishing a high-quality, academically affiliated regional medical center with a strong and collaborative prevention-focused ambulatory care network. We recommend a strong county-led plan to improve public health and primary care, and we can see that plan is already moving forward very effectively. And it is one that needs to foster an inclusive central health planning process that integrates and allows those who are knocking on the doors in the county and lets them know where they need to go, how they can complement what's already here, how they can fit into the vision that has been set, and to coordinate efforts to maximize the impact of the Affordable Care Act in the county. And finally, developing a clear brand. I think we've heard some wonderful adjectives and words here today, and the brand is evolving. But we have a unique county and a unique opportunity to really brand this system. In summary, our study provides unique data and detailed assessments to inform the design and monitoring of solutions to transform health in this county. And with this knowledge base, the system design, and the political will represented by the leaders here today, we feel this system transformation could create a model for the nation, and most importantly, improve the health of the residents of this county and of the region. Thank you very much.
Thank you, Dushanka. I'd also like to recognize Delegate Tiffany Alston, who I think has joined us, and also mention the outgoing dean of the School of Public Health, Dean Robert Gold, who was the dean during most of the time that the study was conducted. So at this time, I'd like to call Senior Vice President from University of Maryland Medical System, person who I've gotten to know well and respect, Mr. John Ashworth.
Thank you, Brad. As you all know, our offices are located in Baltimore, so I bring you all greetings from the Orioles and the Ravens. Is that a good start? Actually, I've gotten to like the Nationals. They're fun. They really are. Watch out for your new quarterback down here. All right, my role here is to maybe talk a little bit more explicitly about the system design itself. And I want to step you back a little bit. Some of this has been referred to earlier. When we started this about 2 years ago, we went into what was called the Phase 1A study, which was a study that was concluded in 2010. And that study, done by the medical system with KPMG as the firm backing us up, basically developed a vision. And it was a vision of the development of a regional medical center of about 330 beds located out into the center of the county. And we ran a series of pro formas that looked like that regional medical center could, in effect, be standing on its own legs within 2 years of opening, and we would have, in effect, then a financially viable regional medical center to start to anchor the whole concept of developing a regional health system in Prince George's County. The consequence of that work was the signing of the MOU, which has been referred to, and that MOU laid out what we call Phase 1B, which was in 3 steps. The first step was the system design. That's what we're here talking to you about today. The second step was dealing with all the financial issues associated with that system design. I'll talk to you about that in just a few minutes. And then the third step was the actual submission of a certificate of need for this regional medical center, which would be scheduled into the year 2013, sometime next year, with the goal to complete the medical center by the year 2017. So again, what we're here to talk to you about today is that system design itself, in effect, and the consequences of the work we've done so far on that. I do want to pause for a minute and say, while we've been doing all that work, the medical system has been engaged with Dimensions Health System on a series of initiatives. And obviously the reason for that is all the improvements we want to make, we don't want to make those improvements when the medical center arrives. We want to make those improvements incrementally over the 5 years as we're proceeding towards the medical center. So some of you all may have read that we have worked to develop a relationship in terms of the delivery of emergency services. The University of Maryland Emergency Medicine Network is now at Laurel Hospital, soon to be here at the Cheverly at Prince George's Health Center, and then by January to be at Bowie. We've worked to develop a trauma orthopedic program here. We've worked to develop critical care capacity here. I met with folks recently to talk about a business plan about cardiac surgery and revitalizing the cardiac surgery program. Step by step, we are beginning to work towards building the momentum so that what we hope to achieve at that regional medical center will be able to move in and have those services in place. I want to say that Judge Nichols has been mentioned and Neil Moore has been mentioned. The boots on the ground here, the leadership of Neil Moore, Dr. Cooper, Cornell Cooper is here, sitting in the back. Carnell and I go way back. You all may know I was very involved in the design of the trauma and EMS system in the state of Maryland, and Carnell obviously spearheaded the second largest trauma center in the state of Maryland, right here, which is second only to shock trauma in Baltimore. But Carnell has taken on the role of chief medical officer and has been an incredible help in terms of working with Neil and myself on issues of medical care. John O'Brien is here, the CEO of basically the Chevrolet site and the Bowie site. and John Spearman, who probably needs a little more exposure relative to the media in terms of his arrival on the scene. John Spearman is the CEO of Laurel Hospital, and John and I work together, obviously, at the medical system, and we're really pleased that John is here along with his colleague, who was one of my students, who was only a B student, but she says she should be an A student. Brenda Fossler. And Singh Taneja was here. Singh has been boots on the ground for us, particularly as we work through a whole series of issues. My point here is we are absolutely engaged in a way that I think is really bringing the benefits of the relationship together. Again, very paced, making sure that we get to all the commitments that we all need to get to. And ultimately, the medical system's involvement here is because we are getting the fact that the commitment is there to achieve the vision that we're laying out here. With that vision, I think we will be able to do what we need to do over the next 5 years. So let me characterize the design of the system. And if you can imagine a Venn diagram with the three circles, and one of the circles is the new hospital system, the regional medical center with its new health system. Another Venn diagram, another circle that overlaps the one I just talked about, is this primary care system, the one with the need for the 61 primary care physicians in the community that Dashanka alluded to. And the third circle is the one that basically says all that coordinated with the public health services that are coming from the county, from the state, and hopefully through support from the federal government as ultimately we design this system. That they overlap right in the middle of it, and I think the unique nature of what we're talking about is we realize that overlap, where all that comes together, is where we get the real power of this system. So what about the new hospital regional health system? Let me describe for you what that is as we have conceived of it. The study that we had done, this step one study, basically goes back, re-looked at the regional medical center, and when we re-looked at it, we knew that as we were plugging in this primary care strategy, what we believed was that inpatient utilization rates would drop. Use rates would drop. That ultimately would mean that maybe we have a little different regional medical center out there than we did before. And in fact, that's what happened. The bed count that we have right now is about 280 beds, not the 330 beds. But it's a very different 280 beds. It's a 280 beds that has a sicker patient population in it, therefore a higher ratio of ICU beds to acute beds, therefore more ORs, a higher technology complement. And ultimately, we will be looking at what the capital implications are relative to the building of that facility. That could range up to 350 beds. We would build at 280, but range up to 350. Why do we say that? The county executive mentioned a few minutes, others have mentioned a few minutes ago about the out-migration of patients from this county to get care. We have made an assumption of a percentage of that out-migration coming back into the county. If you were to assume that we were enormously successful and they all came back, we probably would be looking for a facility that would be bigger than that 280-bed facility. So the consequence of that is we need to build the infrastructure to support that additional capacity. Surrounding that, and by the way, in that facility would be delivered the acute inpatient services that would be typical of a community hospital, but more importantly, or as importantly, would be all the tertiary services that would serve, not only to serve the citizens of Prince George's County, but those in southern Maryland who are otherwise going in elsewhere to get their care. That's a population base of 1.3 million people that this regional medical center will be serving. enormous impact potential relative to the health care and the way it's delivered, not only in Prince George's County, but in Prince George's County and the 3 Southern Maryland counties. Along with that regional medical center, of course, we would continue to enhance the services at Laurel. We got to focus on doing that right now, with John and Brenda's help. Enhancing the services at Bowie Medical Center, which, as you all know, has a freestanding emergency room, very unique. There are only 3 in the state. Medical System has one, the Adventists have one, Dimensions has one. So developing services there, and they would be at Bowie a site that would be not just the freestanding ER, but truly an ambulatory care site where diagnostic services and other specialty and primary care would be delivered. And then developing an ambulatory care strategy, a strategy that has other sites, and the sites that have been identified are in Suitland, and then a site here at Cheverly. In effect, when we would exit this site to build a new regional medical center, what we would replace on this site is an ambulatory care center with all the specialty and primary care here at this site. So 3 ambulatory care sites. In addition to that, of the 61 primary care physicians, we would, in effect, bring into the hospital system, the medical system, 14 of those primary care physicians. So distribution of 14 primary care physicians within the system. So that sounds like, well, that's a great design. The beauty of this is the design is all focused on the issues that Dashanka has just brought up. The chronic disease issues of diabetes, hypertension, cancer, heart disease, asthma, and on the issues that are on this slide right here. Understanding that we're still delivering acute care services as in typical with any other hospital, but we understand where the focus needs to be in order to improve the health. That's where the coming together of the work of Dashanka and us, an enterprise-oriented health system, have come together, and really what makes this quite unique. All with a focus on health. So where do we go next? Relative to the hospital and health system, we move to step 2. And step 2 is not only to understand what the capital costs are associated with the building of the new regional medical center and the ambulatory sites, but also understand what the costs will be to seed the practices of the additional primary care physicians, and then do a pro forma and see if once again we can produce a financial result that says we have a financially viable hospital anchoring this healthcare system. So that's what step 2 is, assuming we can get past step 2. Which means that the county, the state of Maryland, and our rate regulator all have to step up to the plate. We will file a certificate of need for that regional medical center in 2013, as I said, and ultimately, hopefully open the new regional medical center in 2017. All a long journey, maybe not so long, a journey. And ultimately, I will finalize this by saying my 2 key partners in this, the ones who really have the impact of working with the state and working with the county, are Brad and Josh. And I really am very fortunate to have the 2 of them to work with as we proceed with this. Thank you.
At this time, I would like to call the chair of the board of Dimensions Health System, Judge Philip Nichols.
Good news, we're back to 2 minutes. It's probably a good time to tell you, I was born here. I wasn't exactly here when it got started, but not all that long after. In any event, today we write another chapter in the book titled The University of Maryland Medical System Comes to Prince George's County, which I think is already a bestseller. Certainly for all those elected officials who join us today, I am privileged to speak on behalf of not only the executive staff, our president, the members of our board who I'd like to stand, the local boards, or please, all of you. All of you. Fred? And the 2,400 people and the volunteers who really make all this happen every day. If you'd stand, please, and let's give them a round of applause. On behalf of all of them, I congratulate Dr. Kleinman and the School of Public Health for this outstanding and original contribution to our understanding of the health needs and the perceptions of Prince George's County and its residents. The power of this report is the voice of the people. Over 1,000 randomly selected respondents in the county are a very strong indication of where we've been and where we are going. For us at Dimensions, who provide already the lion's share of healthcare in this county, the people will be better able to manage their health when they have a support network that is more available, more accessible, and more expert. With our colleagues, we will build the system of care that people want. We will cap it off with a new regional medical center that will bring university skill and talent to our communities. This report makes the challenge to improve clear, and we accept it. Our partnership is strong. Our resolve is strong. We will be the biggest partners in the University of Maryland medical system, but more importantly, we will be their best partner. Thank you.
Looking this way, we're going to go real quick on 3. 1, 2, and 3. That's lovely. Thank you. We're going to hold for a couple more. 1, 2, and 3. That's awesome. Thank you all for your patience.